to give people the facts and the data. So our panelists and those of us across Georgia and many other spaces can really be great sources of information for details related to how the vaccines were developed, the science and the history behind it, as well as some of the more practical questions that folks want answered. The other part of that, though, is that we must ensure that in our approaches, even though we may, as Dr. Smith shared, have to answer a lot of the same questions over and over again or in different ways, we have to respect where people are. There is nothing like people feeling ostracized or stigmatized because they're not doing necessarily what might be the best thing. We have to meet people where they are, and that means respecting their position and doing a little relationship building towards understanding where it comes from, because it's through doing that that we can develop the best communication strategies that address their concerns and their justified and maybe sometimes not justified hesitancy, but we can only come from a position of understanding. And with that, people feel heard and more willing to listen to what the alternative might be that might be better for their health. The other thing that is important is that, while many of us represent training in public health, community advocacy, clinical training, research training, we have to be sensitive to the fact that we still represent, in many instances, the academy. And while we may look like the community, it's our responsibility to flip that script from doctor or clinician knowing best to communities really being centered, not just to support us in getting a bunch of people vaccinated or to recruit to a clinical trial, but they must be a part of the teams that help us to determine the best strategies and the programs, not after they're developed, but when we're even thinking about the right approach to consider. So one of my partners in Good likes to say, don't just bring me in as a community partner to pick the paint that's on the wall or the pictures that get hung up. Community residents and leaders should be a part of developing the foundation of our why, and not just active participants, but as contributors to exactly what the house should look like. And so Georgia CEAL and many of the other approaches that were described have really centered communities as leading, not advising the work. And so, we have partners across the state of Georgia that represent health departments, that represent those that work with Latinx and other priority populations, but across them, our priority is making sure that they are in the majority to tell us what to do in the ways that make sense. And so when people understand that our intention is to center their leadership and to power our initiatives, not empower because they come with their innate power, but to power our work with their leadership, then we demonstrate not that we're just here to address COVID-19, but that we are on an ongoing pursuit of trustworthiness. So that, I think, are among the pillars of how we can work the pathway forward, and not just as a moment in prioritizing public health, which is amazing, because my parents now know what I do, but that they understand that this really is a time for community-centeredness and community-powered approaches to be a movement towards how we tackle any public health issue moving forward. So they must be centered, we must be sensitive, respectful, and understanding towards developing communication strategies that matter now, but also into the future for what comes next. And there will be other things that come next.